Hello, welcome back to Onye's Legal Forum. My name is Barrister Onye, and I am here today again to preach the good news. Our topic today is female genital mutilation, aka girl-child circumcision. What do we understand by circumcision? Circumcision is simply a process of cutting out the foreskin of a child or of an individual, mostly in male children. But in this situation, this is the cutting out of the foreskin of a female private part. Gross, right? Exactly. Now remember that in May 2015, the then President of the Federal Republic of Nigeria, President Goodluck Ebele Jonathan, passed into law Violence Against Persons Prohibition Act, an act which prohibits and criminalizes genital mutilation or female circumcision. Section 16 strictly says no more female circumcision and further provides adequate punishment for offenders, including jail term of not less than 1 year. One would actually think that the provision of this act would completely put an end to this barbaric practice. But no, a lot of people in Nigeria, especially Southeast, still practice this act. This act is deep rooted in culture that some people believe it is their culture, that they inherited it, so they cannot even stop it, no matter what the law says. But let me tell you that ignorance of the law is not an excuse. You should educate yourself so that you don't fall a victim, so that you don't say, had I known, so that you don't say, I was not told. The law, the act is in the public domain, and you should get yourself acquainted with the provisions of Section 6 of that act, Violence Against Persons Prohibition Act 2015. Get acquainted with it so that you don't say, I didn't know, I was not informed. Besides, these girls who eventually go to adults don't find life easy at all. The girls who were exposed to this inhumane treatment that is against their fundamental human rights as enshrined in the 1999 Constitution find it very difficult growing up as young adults, as adults. Why? Because the people who carry out this act claim that they do it so that the woman can be controlled and put in a box so she does not have sexual pleasure just as the male. I don't know. I don't just understand this. I'm really struggling to understand this. Like, you don't want the female to feel what the male feel because you believe that a woman is not supposed to have pleasure during the sexual intercourse. You feel a woman should not be happy. Let's visit a hospital and hear what the doctor and the nurse has to say concerning this topic and the medical effects. Good afternoon, nurse. So what do you think about female genital mutilation, like circumcising female children?
Aspect of female circumcision, which has been stopped in circumcising women due to excessive bleeding. Meanwhile, it's men that are being circumcised. In the aspect of southern and eastern part of Nigeria, which is the Urobo, how would I put it, Urobo people, they are normally do the circumcision, which they are still doing, both the adults and the children by using contaminated. They can use contaminated scissors, tools they normally use to circumcise, which can cause infection to them. Which can cause infection to them that can lead bleeding to death.
Female genital mutilation involves the partial or total removal of the external genitalia of the female child. So, according to WHO, this is a common procedure back then done with some social and cultural norms associated with it that helps to make the girl child stay celibate, reduce her sexual libido. It has no health benefits as compared to that of male circumcision. So it's part of the things that involve as in degrading women's rights and causing inequality among the sexes. So when you put all these things together, you realize that there is no health benefit of female genital mutilation. Instead, there are complications, both short-term and long-term complications. And there are various types of female genital mutilation. The type 1, which is the most common, is the one that just usually involves removal of the clitoris. Type 2, they remove the clitoris and the labia minora. The complications, you see that, like I said earlier, there are no health benefits. You just leave the girl child with complications, apart from the ones that stem from reduced sexual pleasure, the ones that come from, of course, when she grows old and find out that as in this is what happened to her, as in she'll be depressed. She'll not be able to speak up well to her partners. She'll be concerned why she's not feeling the same way her mates on the internet are feeling. But then real health situations can occur even when this thing happens to the girl as an infant or as adolescent. She can come down with bleeding, she can come down with infection. These infections can result in fever. This fever can result in sepsis. This fever can progress to sepsis. Do you get? This bleeding can result in anemia, child having shortage of blood. Now this cuts, this infant or adolescent can have keloid, so you have left her with a long-term scar tissue. Sometimes it might come down with small complications like urinary incontinence from destruction of the urinary organs during the whole procedure. There are so many other ones, I'm just speaking example, but then again, some of these things can also affect childbirth on the long run. You get, I think there is a WHO paper on it. I think everybody it's easy to understand. No, there is nowhere in the world that I will support female genital mutilation. But then there might be doctors who support it. Maybe they come from cultures who support it, or they still have the same biased perspective about the female child should not be sexually liberated. But then again, it has no health benefits. Culturally, it is backward. Are you getting me? It is redundant. It should not be seen in modern day womanhood. So I think that is all we have to say about it.
We have listened to the doctor, we have listened to the nurse, and I think their words are enough to inform our decision. Now you know better. Would you still encourage someone to carry out this act on an innocent child? Some even go as far as doing this to a girl, to a lady that wants to get married. I don't know, but these are real life situations. From all indication, you have seen that the disadvantage outweighs the advantage. As a matter of fact, there is no advantage, no health advantage, no economic advantage, no psychological advantage, like no advantage whatsoever. So you see that it is of no use. It is a needless norm that should be dropped, should be trashed, it should be abolished. Join this fight. Let us fight against female genital mutilation. It is causing more harm than good in our society. Thank you and do have a wonderful time. Let's meet again this place for more interesting topics.